Are you experiencing mid-back stiffness or tightness, also called thoracic spine stiffness or tightness? Are you worried about getting that hunched over posture as you get older? Do you find that you're getting less flexible in your mid-back? Does it hurt you in the mid-back when you stand for too long or sit for too long? Well, these are common findings as we get older or as we start to sit hunched over more with our devices in our hand, looking at the computer screens. Well, in this video, I'm going to show you 8 of our top exercises that we use in my office to improve thoracic spine mobility and flexibility. Hi, my name is Dr. Frank Altenrath, and I'm a chiropractor at Cresskill, New Jersey at Valley Optimal Spine. And in my office, we've helped hundreds of patients with acute and chronic spinal conditions such as neck pain, low back pain, herniated discs in their neck, herniated discs in their low back, numbness and tingling in the hands and the feet, down the arms or down the legs. And we do this using corrective chiropractic methods that focus on correcting the spinal alignment along with posture. So if you're new to my channel, I would invite you to subscribe by hitting the subscribe button down below and click that notification bell so you keep up to date on our new weekly content that we put out that talk about topics such as this, along with exercises and tips to live a healthier life. So before we go over the exercises, let's talk about the importance of keeping the thoracic spine or mid-back flexible. So the mid-back thoracic spine sits between the cervical spine, which is the upper neck, and the low back, which is the lumbar spine. If there's any problem with the low back or the neck, the thoracic spine sitting in between the two is going to show effects. So in everyday life, we sit at our desks all day, we look at our phones or tablets, and we start to lose that neck curve doing these things. As that starts to happen, the thoracic spine will have to start to compensate and become tighter. The muscles will tighten up. Everything will just become more rigid. So you'll notice, for example, if you're trying to bend over to pick something up, or you'll notice in a mirror or in a picture, a photograph, that your spine is starting to lean forward, your posture is leaning forward. These are all issues of a thoracic spine that's starting to malfunction. When we have patients in our office here, we can tell right away the health of their spine just by palpating their mid-back. We can already see that, and it could be at any age, that they've got some spinal conditions that are beginning, and the thoracic spine really tells us a lot about the health of their entire spine. So mobility of the mid-back or thoracic spine is very important. As far as the ranges of motion, these joints right here that you see along the side of the spine, these are called your facet joints. In the neck, these facet joints are angled at about 30 degrees. In the thoracic spine, they're angled at about 60 degrees. And in the lumbar spine, they're angled about 90 degrees. So therefore, at 90 degrees, most of your motion in your lumbar spine, your low back, is flexion and extension. In the thoracic spine and the neck, we have all ranges of motion. We have flexion, extension, rotation, and then lateral flexion. The exercises that we're going to show you in the video coming up are going to be mainly addressing the rotation component and then the extension component, because most of us lose our extension ability as we start to round our shoulders and our spine starts to come forward. So we want to make sure we address extension and rotation in the thoracic spine. So the first exercise we're going to go over now is the cat-cow exercise for thoracic mobility. So you just get on all fours, get into a cat stretch position, and arch your back up into the air. Hold it for a few seconds, and then bring it back down. And like all these exercises, repeat these 4 or 5 sets, 15 to 20 repetitions. And like anything else, if there's any pain, never exercise through pain or discomfort. So the next 2 exercises are going to involve a foam roller, which you can get at any Kmart or sporting goods store. So you place the foam roller in the middle of your back and bridge up. You take your butt off the mat into the air, and roll back and forth on the roller. Try to keep your head nice and level, and try to loosen up the entire mid-back or the thoracic spine. And if you might feel some tender areas, but that's normal. Again, this is just to mobilize every segment in the thoracic spine going to the upper lumbar spine or low back. Okay, and once you've done that, now we can do segmental mobilization. So you're going to put the roller down more toward your low back, and you're going to cross your arms, and with the roller in your low back or upper low back, you're going to put your hands behind your head, keep your butt on the floor, and try to extend all the way back. This is for thoracic extension. So we're trying to mobilize each individual segment into extension. Okay, then come back up, and then you're going to roll back the segment a little bit higher, and come back up between each one. Okay, so now you keep the roller moving up a little bit, and just get a good stretch and try to extend at each level. And you're going to find that some levels are going to be much tighter than others, so those are the areas that you can just stretch a little bit more. And we stop at about the shoulder blade area. Maybe a little higher if you can. Okay, just like that. The next exercise we tell patients to do is laying on the floor on your knees and maybe putting your hands on a chair, stool, or the couch, and then you're going to extend at the mid-back. So you're going to use the couch or the chair as a lever, and you're going to just extend and hold it there. Try to get as much extension as you can, and just hold that extension. You could also lean on your elbows on the chair, and you could do the same movement. Try leaning on your elbows. Yep, like that. Go back in, and just hold that extension. Come right back up. Try to again, hold that extension. And again, depending on how mobile your spine is, you might not get much movement, but this is definitely a good mobilization exercise you could start doing at home. The next exercises are going to involve thoracic rotation. So put a pillow or a foam block underneath one of your knees, and on the other leg you're going to stand in a lunge position, cross your arms in front of your chest, and you're going to rotate to one side, try to get as far as you can, and you're going to hold it a few seconds, and then you rotate to the other side. And you'll notice that one side might be tighter than another, but just keep doing 15, 20 repetitions to each side. And then for the more advanced version, you could try to put the hands behind the head. That makes it a little bit more difficult. And you can see how the range of motion will be a little bit more diminished there. But this is a great exercise for thoracic mobility in rotation. Okay, another thoracic rotation exercise would be getting on all fours on a mat and taking your one arm, so let's start with your left arm, put it behind your neck, and then rotate your elbow down to your other arm, and then try to rotate it up and attempt to get as high up toward the ceiling as you can, keeping your back flat. And you're going to find this very challenging to get your elbows to the ceiling. So in this case, this is now going to be right rotation, or left rotation, I should say. Now you switch arms, and we do the same thing. I'm going to go for a right rotation of the thoracic spine. Trying to keep that back flat and just rotating at the mid-back. And that's for thoracic rotation. So another great exercise we give to our patients for thoracic mobility is an exercise for, again, thoracic rotation. So you lay on your side on the mat, putting a pillow or a block underneath your head to keep it level. You're going to grab with your arm that's underneath you, you're going to grab your knee that comes up, and you're going to take your other hand that's straight, touch the floor, and then slowly come up and rotate, and attempt to rotate your thoracic spine all the way back and try to touch the floor with the back of your hand. And then come back and do it again. And this is now going to be for left rotation of the thoracic spine. And make sure you keep that leg down so the leg doesn't come with you, and you get some pelvic rotation by doing that. So hold the leg down, So we isolate the thoracic spine. Again, always do about 10 or 15, 20 repetitions, 3 sets. And you could also do the same thing, just switch sides. Another great exercise for thoracic rotation, you stand against a wall with your inside knee on a block and your outside leg in front of you. So put the leg more in front of the other knee, so more toward the wall. Okay, right there. And then you're going to touch the wall with the back of your left hand, and you're going to clap your hands together, and then you're going to rotate your outside hand and follow the hand with your eyes all the way until you touch the wall behind you. And keep doing that. Do a few sets of those. That would be for right rotation of the thoracic spine. Great exercise for thoracic mobility. Just like that. Okay, always maintaining your left arm against the wall and the right arm. Try to touch the back of the right hand to the wall behind you. And then we will switch sides. We do the exact same thing. Now it's the right hand against the wall. Keep it straight and rotate till the back of the left hand touches the wall. And you may find that one side is much, much stiffer than the other, where the hand will not even come close to the wall, where one side will. And that'll let you know the side that needs work. So this is for thoracic rotation. Great exercise. And now for one bonus exercise for thoracic rotation, and this is a bonus exercise because this is the most challenging. It's going to be in a side plank on your elbow. Reach underneath your body with the up arm and then rotate it to the ceiling. Come up all the way and rotate to the ceiling. This is going to be great for rotation of the thoracic spine as well as core strength. It's very challenging. If you could do 3, 4, 5, that's great. But this is more for advanced. And then we stop and we'll do the other side. Same thing. As with all exercises that we talk about on this channel, make sure you get the okay from your physiotherapist or your chiropractor who knows your spinal condition before you begin any exercise program. I hope you found those thoracic spine mobility exercises useful. And remember, just pick a few that you can do comfortably without any pain and work your way up to the ones that you find more challenging in the beginning. In our office, we give our patients a few of these depending on their case presentation, depending on what we find in their x-rays, and then we work our way up to the ones that they find more challenging. But they certainly don't get all of these in one shot. These are just a sample of the exercises that we do provide or that we find very beneficial in our office. So if you found this information useful and you know someone else that could benefit from it, please pass the video on to them. So until we see each other again, thanks for watching, and we'll see you next time. Have a great day. Valley Optimal Spine is at 80 Broadway, Suite 1A in Cresskill, New Jersey. Our telephone number is 201-569-1212.